our executive session has concluded. We're back in public session at this point, and we have a number of resolutions to consider. For the first item, I will turn it over to Paul Albertson to read the resolution.
Good afternoon. Thank you, Frida. Our first item is the Cardinal Health contract renewal, and the resolution is authorizing New York City Health and Hospitals Corporation, the system, to sign a 3-year best interest renewal contract with Cardinal Health 200 LLC, the vendor, for distribution of medical, surgical, and laboratory products for the system, providing forward purchasing of products, warehousing, and shipping, with 2 1-year options to renew the contract, exercisable only by the system, and with the total cost of the contract over its full potential 5-year term not to exceed $608,800,000. This afternoon, okay. And this afternoon, thank you. We'd like to present our request here, and Joe Wilson will be leading our presentation with our PowerPoint here. And thank you, Joe.
Great, thank you. The standard practice of all healthcare systems is to utilize a distribution partner to warehouse and distribute medical surgical products. So whether you're a large academic medical center, a large municipal center, all the way down to kind of a rural access, all hospitals use distribution partners in order to manage their inventory. Cardinal Health is the prime distributor of medical, surgical, and laboratory products for the system, providing the forward purchasing of products, warehousing, and shipping that permits to provide customers with one comprehensive supply platform. This is used in all facilities: acute, post-acute, Gotham, and correctional health. The original agreement was awarded via RFP in 2008, and a 3-year best interest extension was executed in 2017. And then subsequently, we had a 1-year extension because of COVID in 2020. The estimated annual spend is about $110 million. The current spend was $154 million, which is all directly related to COVID, the increase. And our cost of goods will remain the same. So 1.1% is the markup on national branded products, and there is no markup on the Cardinal branded products that we use. All of the products within that Cardinal distributes are selected by the system and contracted unilaterally by the system directly with the manufacturer. Of the $154 million that we spend to Cardinal, only $1.168 million is in the distribution fee. And the contract has expired July 31st, 2021. Could we move ahead to slide 5 so I may tie those numbers together? Okay, so if we take a look in the financial section, the top bullet point, $2 million in rebates on Cardinal branded products are realized annually against an estimated annual spend of $1.1 million in the fees. So we are actually earning $900,000 in the distribution agreement. So that creates what we call a negative cost of goods within it. We have enjoyed $13 million in savings in this agreement since August of 2017. And we believe that the 1.1% markup is an industry low, also coupled with the Cardinal brand 0% markup of their products. If we move back to slide 3. This is the market view of the distribution market in the U.S. 3 suppliers represent 95% of the distribution. Cardinal, who is our vendor, is the only supplier that can provide medical, surgical, laboratory, and pharmacy distribution. Cardinal provides a dedicated on-site resources as part of the support model. So we probably have between 12 and 14 Cardinal employees who help with everything from clinical conversions to accounts payable to customer service, working with product. The other 2 major players are Owens & Minor and Medline. Owens & Minor had put themselves up for sale in 2019, and Medline put themselves up for sale in March, and as of this morning, had sold their majority share to a venture capital group called Blackstone, Carlyle, Hellman, and Friedman. So there's a little uncertainty within the competition of Cardinal. Maybe slide 4. So within the Cardinal partnership, we really want to kind of hit on 3 salient points. 1, the core business of distribution. the excellent job they did supporting the system during COVID, and our work with them in operations that are going to bring further efficiencies and savings. So in distribution, we pre-purchase, we have the products brought to us, and they also offer third-party logistics. So we currently have, several thousands of pallets of our pandemic supplies, which we hold in the event of need that we could not hold in our facilities or through our regular distribution agreement. Within the regular distribution agreement, they deliver 5 days a week to all of our facilities. Weekend courier services are available, and they have a dedicated full-time employees who just work here at H&H. Regarding the COVID support, really fantastic. We were prioritized when things were very, very, dim when it came to getting PPE, critical care, vent supplies. We were prioritized. We never ran out. They moved from their distribution centers all over the country, flew things overnight at their expense to make sure it was here the next morning. And they really provided 24/7 support, lots of work at night, lots of work on the weekends. And those costs were never passed along, and they gladly did it. And they were also one of our real subject matter experts as we were working with people outside of our normal channels during COVID to look at this. They worked with the manufacturers to make sure product that we were sourcing was authentic and safe. And that was just another service that they brought to us for no cost because they wanted to make sure the customer was taken care of. And then the last part of this in the COVID support, because there was such an incredible shortage of all raw materials, the products in which we use to make our OR custom kits were so short, they were actually sourcing themselves, and they had put a team on site at Bellevue to build the kits on site so we didn't have to cancel any surgeries. And that was 6 or 7 people who they flew in the middle of a pandemic to live on the 12th floor of Bellevue so we wouldn't interrupt any surgeries. In our operations, one of the things that we're doing to kind of streamline our cost is moving from bulk ordering to just in time. So instead of having to order a case of 200, but we only need 20, we can get the 20 and not leave that money on the shelf. And that really is kind of tied into our blue bin inventory system where we are now going to use the logical unit of measure. So instead of ordering by the case, we're going to get what we need. And Cardinal's going to break that down for us at the distribution centers. And that allows us to then bring in barcode reading and touchless ordering. So we don't have to worry about people running around with clipboards to make sure they're out and get that electronic feed right from that data. And the product just shows up the next day. Next slide, please. And this is, the contract justification rule. We had talked about the negative cost of goods. We had talked about, their value during COVID and the investments that we jointly made together around inventory, which is going to ensure lower cost and better readiness for our clinicians. And the additional synergies that we've been able to, leverage for better cost and smoother operations, our pharmacy distribution, our lab distribution, third-party logistics, OptiFreight program, where they allow us to buy in using their amount of freight that they buy through FedEx, so we can buy in at the lower rate. So items that are shipped to us through that, we get to enjoy a lower freight cost. And the surgical custom pack program that allows doctors to have just what they need per procedure, per doctor that they build for us. Next slide, please. And then just kind of going through this again, just a little bit of a repeat. The operational continuity that we want to enjoy with the pandemic response that's still going on, our blue bin implementation for our inventory program, and the supplier transition consideration. So we don't want to interrupt any patient care. These are 50,000 items that would need to be transitioned over. The amount of temporary staff that would be needed, for months, if not a year, to move this forward. And the custom surgical pack program would essentially have to go on hold for an entire year and create some problems in the OR. Next slide, please. So a best interest renewal under the Systems Procurement Operating Procedure 100-5 is where the system determines in our best interest to renew a contract rather than re-procure it. This is permissible under the operating procedure when the best interest determination is supported by a cost-benefit analysis. So what I've gone over in the previous slide, these are all of the things that we would kind of need to redo the work that we've already done and also projects that we would need to suspend. At a minimum, we believe it would cost $18.13 million to convert from one supplier to another, from everything from having to move out our 3PL program, to have to redo custom packs, to redo the item master within PeopleSoft, and redo the inventory system that we've already been working on for 2 years. Next slide, please. Another part of the due diligence that we spoke about was Premier Group Purchasing Organization. So they did an RFP for distribution amongst the 3 major providers, and the best they were able to negotiate was a 3.75% markup. And they were using their 3,600 member hospital spend. So as opposed to our 1.1, we're enjoying a 60% greater discount than a national GPO, what they're offering their customers. We could, next slide, please. And then for vendor diversity. So as we discussed, 99% of this contract is really the goods that we purchase. There are, historically, this contract was excluded from MWB just because there was a lack of diverse vendors to buy the goods from. Cardinal has worked to increase MWB participation by adding 18 vendors by July 2020. The total annual MWB spend today is $957,000. And that also includes some Cardinal subcontracted work, which they've now subcontracted their weekend courier services to an MWBE. In addition, there's 5% of the annual contract spend that are with diverse vendors, but they are not New York City or New York State certified, about $5.5 million. Based on the 8.12% currently achieved, and the additional open opportunities, we're recommending a goal of 8.52 for the first year. Cardinal has committed to working with H&H to doubling this to 17.04 by year 5 of the agreement through a combination of adding more vendors with viable product and also subcontracting as well as many services as they can. Next slide, please. This talks a little bit more about their global presence. So really about their stewardship. They have 2,700 diverse supplier partners around the world. They have $847 million of annual spend with diverse suppliers in medical and pharmacy and corporate services spend. They have stepped up the supplier engagement. So they are working with vendors through the National Minority Supplier Development Council and Intercity Capital Connection. So this is indicative of what we're going to talk about in the next slide regarding their investment. And Cardinal has shared that their plan is to invest $36 million over the next 5 years in MWBE supplier development and outreach. So over the past couple of weeks, we have met with their chief diversity officer, and we have put together some really strong plans about, this type of outreach, growing the supplier base, and their commitment in that area. Next slide, please. This is their corporate workforce diversity. As you know, this is just the United States. They're a worldwide company. But we do also want to direct you to the bottom of the slide. So we have our own support staff here at H&H that we could be more influential in the hiring of. And it is 57% female and 50% ethnically diverse of the health and hospitals direct support staff from Cardinal. The next slide, please. So the Finance Committee approval request, we are seeking approval to enter into a contract under the best interest renewal provision in OP 100-5 with Cardinal Health 200 LLC for medical distribution services. This would be a 3-year contract with 2 one-year options exercisable at the discretion of New York City Health and Hospitals, effective August 1st, 21, with a not to exceed of $608,800,000, with a first-year MWB goal of 8.52%, $10,373,952, increasing to a year 5 of 17.04%, equaling $20,747,904. And I'll take any questions you may have.
Great, thank you, Joe. I'm gonna go through the members and ask for questions. I'll start with Jose.
I don't have any questions. I just want to commend the whole team for working in this very complex contract. I know that I'm sure a lot of work went into it. I'm particularly happy to see that there's an increase in the NWB goal, and there's a commitment to increase diversity in the process. And I want to thank everyone involved: Joe, Paul, Danielle, Keith, in making all of this happen. So thank you.
Great. Thank you, Jose. Dr. Katz?
Just again to say thank you to the team, because getting a better price means more services for our patients. So it gives us more money to hire more nurses, more doctors, and be able to take care of people better. Thank you.
Great, thank you. Philip Waddle?
No, thank you, Frida. Well done, everyone.
Thank you. Sally?
So, what I struggled a bit with were the two figures, the $1 million of their fee and the $608 million over a time period of the spend on product. And I guess, like, from my own lens, and I may be seeing this incorrectly, it's Cardinal is in it not just for the $1 million fee, but because we also purchase their product, and we purchase over $600 million worth of product. So I'm curious to know, in the last year, what was the spend on Cardinal products?
Sure. So, Cardinal products, the Cardinal brand is generally about somewhere between 25 and 27% of all of our spend.
Okay. And
through that distribution agreement.
Right. And do the individual hospitals make the decision on whether to use an actual brand or Cardinal, or is that made centrally?
No, absolutely. So all products are picked by clinicians, whether it's a nursing product or a physician product. And to let out the dirty little secret, Cardinal branded products, you think of them as a generic, but their product needles are made by a major brand called Smith's Medical. Their blue wrap for sterilization is made by a major brand, Halyard. So it's really kind of like the generic version of it. But when we move from a name brand to a generic, the clinician, the end user group, has to approve the use of that product. And that goes with any clinical product. All decisions are made by clinicians.
Okay. Thank you very much. That helps to clarify the kind of dual relationship in a way that we have with Cardinal.
Mm-hmm.
Great. Thank you, Sally. Fenioski?
Thank you, Frida. Again, I just want to thank all the team for your negotiating skills. As Dr. Katz mentioned, being able to negotiate the best price to ensure that there is resources for all the very important programs that we need to fund. I also would like to commend you for how well you articulated the best value renewal. I think each point was addressed and really explain why this is the best for our system in terms of pursuing this particular continuation of the contract. It makes it very clear that here we are being very good steward of the system resources and ensuring that we have the best financial arrangement that we can in a holistic manner. So I would like again to thank the team for such a wonderful and detailed and comprehensive explanation, which made, at least in my mind, everything clear. Why this is the best course of action. And lastly, I also would like to commend the team, Danielle, you, everybody, for your work on the MWBE. I think it's quite impressive what you have accomplished since 2020 in going from a zero MWBE with total waiver to a commitment in the first year of 8.52 and a commitment by year 5 of 17.404. This is definitely something that should be serving as a model as we are talking to other large corporations that we have seen before that always come with the same. Can you hear me now, or you lost me? Can you hear me?
Yes.
Yeah, we hear you.
Yes.
Okay, sorry about that. I was just saying that, using this as a model for other types of procurement, which you have seen companies as large as Cardinal that communicate that they are not able to increase their NWB spend. And here we see Cardinal, and with your support and coordination, to not only stretch themselves to ensure that they are able to bring that group of MWBs to participate in the contracting, but also committing to continue to invest and with a specific dollar amount on their supply chain, MWE supply chain development and outreach, which I think is really incredible. They are not only saying, we don't have it, it's not available. They are committing to develop capacity to provide. And I think that's a very smart, socially responsible move. So I would like to thank all of you and also thank Cardinal for being at the forefront on ensuring that they are putting their money where their work is. And so this is very impressive. And I would like to commend all of you, Danielle, everybody, for your work on all this. So thank you so much in all those fronts.
Frida, can I just ask one other question?
Of course.
Okay.
Go ahead.
Yeah, I think the best interest circumstances are very thoroughly vetted, because it's something we don't like to do without compelling justification. But I do think it might be worthwhile in the next 2 or 3 years to put out some kind of feeler to get a sense of whether there's any real competition in the marketplace. I know that there are a lot of additional costs we're going to incur, but there may be benefits to a company to being able to secure this contract. So that's just a thought that we've had the contract for some time, and it might be that there are, compelling factors that would create a more competitive environment. That's it.
Thank you, Sally. Yes, I agree. I think there, I had some concern at first with an 18-year contract, which is what this would be at the with the renewal. But I do think that the team, as Fenny indicated, has done a really good job, laying out all of the details and the benefits of the best interest renewal, and certainly has demonstrated the value of the partnership and the great work that Cardinal has done for us through COVID, and the synergies and how we work with them in many ways. And so I think that's been a great exercise, but I do agree with you, Sally, and team, Joe, Paul, Danielle, that as we get our inventory management system set up and things are more stabilized in that way, that we do take a look at the landscape. As you pointed out, Joe, it's been changing with many of the few competitors, or a couple of the few competitors in transition from their corporate structure. So, but I do think it would be appropriate to keep that in mind in the next few years, if possible. I also just want to echo the words of Fenny and Jose and Dr. Katz and Sally, that you guys have done a great job doing the diligence on the pricing and the contract, and bringing Cardinal along with us on our diversity priorities and the great work you've done there. So thank you all for your focus and attention on that. Are there any other questions? There are two comments I wanted to raise just on the text of the submission. Before I get to that, is there anything else from any of the board members? Okay, so on the resolution itself, I don't know if, Khaleesi, we could get that brought up. Perhaps it would be easier. But the text of the resolution.
I am gonna try, Frida, we don't have it teed up
Okay.
yet, but let me try.
Oh, okay. It's just, do you want me just to reference it?
Yes, please do reference it.
So the resolution has five whereas clauses. In the fourth, there's a reference to the existing agreement remaining net negative in total cost. And this is something we've talked about that I think the team has done a really good job of describing. The contract itself that we're approving is $608 million because that includes the cost of the purchases. But the fee itself to Cardinal for the distribution services ends up being net negative, as Joe described, given the rebates that we have. But I just thought for clarity, we could to take the net negative in total cost out of the resolution, since we are approving a contract of $608 million here, the board. So I would like to propose that. I don't know, I can ask the members if there's any comments they want to make along that.
I'm okay with that amendment.
Makes sense.
Okay. So, okay, so that would be my proposal. And the second thing, and this is not actually in the resolution, but the executive summary that's provided in the board materials, we referenced the 8.5% MWBE commitment. I think similar to how it was presented in the PowerPoint, where we talk about an 8.5% commitment that is growing to 17, I think. I don't remember the exact percentage, but in the 5-year time frame, that perhaps we can change that language for what's submitted to the board as well. Does that work, team? Joe, Paul, Danielle?
Yes.
Okay, great. So with that, if there's no more comments or questions, I'd like to go ahead and call for a vote on the motion on the resolution. So I'll start with Jose.
Yes.
Frida, just for clarification, we're voting on the amended resolution to be presented to the board, okay?
Yes. Thank you, Felicia. So on the amended resolution with the proposed deletion. So Jose?
Yes.
Dr. Katz?
Yes.
Philip?
Yes.
Sally?
Yes.
Senioski?
Yes.
And I vote yes. So the resolution is approved. Thank you guys very much for all the work.
Thank you.
So the next action item, I think, is Chris Keeley is going to take us through on testing and
Yes, good afternoon.
test and trace. Yep, great, thank you.
Thank you. I'll read the resolution first. Thanks, Paul. Item number 4 on the agenda here, action item DOE and mobile unit testing expansion. Authorizing New York City Health and Hospitals Corporation, the system, to amend its contracts for school and mobile COVID-19 testing with each of Rapid Reliable Testing, Inc., BioReference Laboratories, Inc., Fulgent Genetics, Inc., Somos Healthcare, Inc., DBA Somos Community Care, MedRight LLC, and Premier Assist LLC to increase the not to exceed limit on the 5 by $17 million from $189 million to a total amount not to exceed $206 million. So good afternoon. Again, my name is Chris Keeley. I'm Chief Operating Officer for the Test and Trace Corps, working under Dr. Long, who's also here today. This body of work is to help address the large need for testing in New York City that continues. So as we all know, New York City faced some of the harshest and earliest impact of COVID-19. 2 of the major ways that we have as a city been able to respond to that are with DOE testing in the public schools, and that's testing in all of New York City public schools on a routine basis, currently weekly basis, currently performed by BioReference, Fulgent, Somos, and MedRight at a cost of about $16 million per month. One of the other prongs of testing that is done under Test and Trace Corps and as part of this existing contract is community testing. The bulk of that work is mobile testing. So testing literally out of a van. Think of something the size of an ambulance that can pull up to the street corner, set up a folding table and test people on the sidewalk, or even in some instances, the van is equipped so that patients can come inside the van. All of them are ADA accessible. So testing on mobile units or other types of testing outside of public schools, that's currently done primarily through rapid reliable testing, but there's also large bodies of work done with MedRight and Premier Assist, currently at about $8 million a month. Across the board, vendor performance has been satisfactory. And currently, based on our best information and projections, the board authorized the requested $189 million for this work in December. And we expected that would pay for all needed testing for 6 months, which brings us to about now. We're nearing the not to exceed in June, and we're requesting an increase of $17 million to take us through until a new round of contracts. An RFP has already been put out. We've already received responses back, and we're looking to bring that to the board in the weeks and months ahead. And so this is to help carry us with the current terms of the contract until those new contracts can be executed. So we've issued and final. Okay, so DOE testing. That's fine. Next slide is fine.
Next slide. Sorry.
No worries. And then the T2 testing regimen has allowed New York City's public school to stay open. As we know, it's the largest public school district in the country. It's been an overwhelmingly successful program and a really important piece of the city's safe reopening of public schools. And so as part of that program, we've had, and apologies if people are hearing the buzzes, there's an alert on phones right here. As part of the program so far, this deck shows 1.2 million tests conducted in schools since October. In fact, by now it's 1.3 million tests conducted in schools since then. Positivity rate is well below 1%, which is really just astounding. On the mobile testing unit, we've got 40 mobile units that are out there testing every single day. As of last night, we had 280,000 tests conducted through that process. So more than 250,000 tests have been performed at these mobile units since October, including identifying 17,180 New Yorkers who have tested positive through those mobile units. We've got dozens of community testing teams out every week doing 10 to 20,000 tests per week. And something that we've really been increasingly proud of is that the program has really shifted from just chasing numbers and positivity, but we've been coupling that with a really community-driven approach where community organizations are really helping to, when we say, okay, we think that we need to go to neighborhood X or neighborhood Y, working with community organizations in advance, working with elected officials in advance, so they can help us understand, go to this part of the neighborhood or go to that part of the neighborhood. They can help us get connected with other partners that can help generate patients that will come out and get tested, because that really is such a big piece of a program like this, is developing that trust, developing that relationship. And so by having that community-driven model, we think that's been a really big part of the success. Next step, next slide. So the DOE and community testing, as I said, are critical components. The existing approvals allow for a not to exceed of 189 million. We're nearing that by the end of June due to robust testing. And as expected, the contract, as I said, goes through December 2021. It's just that we're hitting up on the not to exceed. So a new solicitation for proposals was approved by the CRC. Solicitations were due on May 28th. As you see, we received 29 applications. The review committee is currently reviewing them. We've gotten some very, very robust proposals. As hoped, we're seeing some new types of testing. We're seeing new levels of creativity in terms of what the vendors are able to bring to the table, which is one of the reasons why we wanted to send out a new solicitation on go-forward basis, rather than just taking this existing contract and carrying it out through December. We thought we could find new creative ways to do testing to reach people and potentially even save some money. I think that we may be able to in some circumstances in those new contracts, and we'll bring that back to you after the review committee's done reviewing those. We expect to have that selection done in the next week or so. So in July, we'll present for approval to the board the result of that solicitation. But to continue the good work that's underway now, we're asking that the board increase the current contracts by $17 million from 189 million to 206. This funding will come from New York City under the existing T2 MOU with OMB, which is effective for expenses through June of next year. Next slide. For the MWBE slide, the vendors here, there were 6 vendors that we contracted with under this agreement. As you see on the bottom there, the 6 vendors so far, we've expended about $104 million, of which 22% has gone to MWBE spend. MedRight, they've spent about 8% of the $8 million on MWBE and have a new subcontractor for staffing, with that spend increasing month over month since they began in month 3. So they, and it's common with these others, they use the first month or 2 to develop a new partnership with a new vendor. Because we needed them to start work right away, they used some existing vendors. Over those first 1 or 2 or 3 months, a number of these vendors established new subcontracting partnerships, particularly on staffing. And then the spend began on month 3 and 4. And so with Fulgent, you see $30 million paid to date. They have their staffing subcontractor now locked in, as does Premier. Their spending has begun. Rapid Reliable Testing, you see $18 million paid to date. And I just got a note earlier today of the $20 million that we're expecting to expend with them over the next few weeks. In total, they're going to have at least $2.5 million going there. So while it's a modest amount now, they expect to be well over 10% by the time end of July rolls around. In addition, 2 of the vendors, Somos and BRL, if you can go back for a moment, thank you. Both Somos and BRL well exceeded a 30% target with 4.9 out of 5.8 million with Somos and 16 million of about 41 million with BRL. So overall, these contracts were at about $23 million out of 104 million. Each of these vendors proposed to continue work with us under the new contract. I expect that a number of them are going to score well, and that they would be able to, should we continue work with them in the future, they would be able to leverage these new agreements that they have with these subcontractors under these new contracts right from the very beginning, and that would help increase their MWBE spend throughout the life of any new contracts that may take place. Next slide. So in summary, what we're looking for is seeking approval to increase the not to exceed by $17 million for this contract for the 6 vendors listed, from the not to exceed from 189 to 206 million. Again, the contract terms will stay unchanged for this period of time. And this is all funded under the T2 MOU with OMB that carries us through next summer. So thank you, and be happy to answer any questions or take any feedback.
Great, thank you, Chris. I'll start with Jose.
I have no
questions or comments.
No questions. Thank you so much.
Thank you. Mitch?
No.
Great. Philip? Philip?
Frida, he dropped off the call.
Oh, okay, sorry. Sally?
Yeah, I'd like to go to the T2 CBO milestone completion. Some of the changes between expected and actual were staggering. And I'm wondering kind of how that happened. Like, I'd like to better understand the line that says contacts from phone and text bank or call line.
Oh, Sally, I think that's the next resolution. I think that's the next one.
Oh, I'm sorry. Okay, I'll wait.
That's okay. You're ahead of us.
Okay.
Are you good on the testing, the mobile testing and the
Yes.
testing?
Yes, I'm fine with that.
Okay, great. Thank you. Svenioski?
Thank you, Frida. I do have a question. If looking at the MWBE, I noticed that Fulgent, let me see, the contract, Fulgent Genetics have a waiver to only have 15% MWBE, while all the others committed at 30%. What is their business model so different that it will require a waiver to 15%?
Sure, I'm happy to take that. Or Keith, if you're on the line, I know that you were involved with that as well.
Yeah, hi, Penny. It's Keith. Thank you, Chris. So this was at the time, December, I think, when staffing was very difficult to obtain. We'll expect that to change with the new solicitation, Penny.
I understand, but what I don't understand is that we are doing this renewal. And when you find a company that is doing very similar work than other companies, how come those companies have waivers to half of the NWB requirement and the others do not? I'm having a lot of difficulty understanding that. I'm having a lot of difficulty why this renewal does not address those challenges. And if you look, they are the second largest contract. They have been paid 30 million and they have zero spent in WB. I'm just having a lot of hard time. A lot of hard time with this.
I agree, Fetty.
Yeah.
So we've been working very closely with all of these vendors, having weekly touch bases with them and asking them to provide their updated weekly reports on their MWBE spend. We have been working across the different teams, identifying staffing vendors that are able to meet the needs. And we are working with Fulgent to see if they can get to 30%. Right now, they've only committed to 15%. And like, you know, I mentioned before, we expect this to be the last portion of this contract and have higher expectations on this second tranche of work resulting from the new RFP.
Keith, I understand that, but I'm saying we are now adding more money to the existing contract. I understand that this was done and it had those, but what I don't understand is that we come back, we try to extend this, and we don't go and have those conversations with these vendors because I'm having a hard time understanding how their business model could be so different than the others that have committed 30% that they will do a reduction of half of the NWB requirement. And now what I'm hearing, and again, this is what I'm hearing, is that we are going to address that in the new procurement. Why wasn't this addressed in this request of asking us to add more money to this?
I think, frankly, it's just a matter of time. This is 1 month, so operationally they can't ramp up to meet 30% in that short time frame. So I didn't want to place unrealistic number on the work that they're doing. You know, just in these 4 weeks, they can't get to 30% given their progress to date.
Well, the message that we are sending them, sorry, let me just finish this because I think the message you are sending is a lot even worse, in my opinion, because they have not spent anything. So if they are not going to be able to get it, and you're telling them, well, you know, it's a pass, because I don't know how you are even going to get them. They already spent 30 million in 1 month. How are they even going to go to the 15? So I believe we have to be very consistent in our message, and this does not seem consistent. I'm having a really hard time on the message that we're sending and how we are tracking this, because 30 million and they don't have any expenditures as of now. They have a waiver of 50% of the requirement. I think this is the wrong message.
And just one other brief thing that I would add with this, and it's not about the 50% of the rest of the target, but just as a point of context, one of the other levers that we do have available is the distribution of work, right? Going forward, what is the distribution of work? And if someone is not showing a good faith effort towards meeting these targets, and it sounds like you're saying they are not, and not to put words in your mouth, but that's what it sounds like to me. One of the things that we can think about is moving some work, right? We've done that in other parts of this contract. You'll see one of the other vendors there. It doesn't have a $30 million spend. It's under $1 million, but they also have no substantial spend under this yet. And what we did last month as part of that effort was we took some work away from them. We took the largest chunk of the work they had and moved it to another vendor that was showing a good faith effort. And so this is something that, from an operational perspective, I agree with Keith. It's not something that we can fix in 1 month to be able to hit these types of targets. But it is something that now we've sort of let it be known to all the vendors under this contract that if they're not making their best effort, that we're going to take work away from them. And if it may mean that Fulgent is going to continue for a short period of time, but we need to think about the type of work they're doing and the volumes of work they're doing, that's absolutely something operationally we can look to be doing. And that's actually, I should say, that's something I had a direct conversation with their senior vice president about on Thursday night. letting him know how serious this was, letting him know that I was going to be needing to come to this venue and that was going to be a pain point. And I told him that some of this work that they have is currently on the line.
Well, but let me tell you, you said that you didn't want to put word in my mouth. I can just say it. If I look at the data that you presented, again, on the NWB, there is no question in my mind that they have not met even the waiver that they were given, which was a 50% of what is normally required. And they are the second one in volume. So now you are saying, again, I have the highest praises for all of you of what you're doing in T2. I'm just looking at the data that is in front of me. And the data here says that the actions that you are thinking or explaining that you may take should have been taken way before, because here they already have $30 million spent and they have not shown any expenditures in NWB. So if we're only talking about a month, they will never make up. So they will never meet even the lower bar that was given to them compared to the others. Again, we're looking that the others committed, okay? And at least they have tried, but this one didn't even try. I'm just very concerned with the message and the way that we are approaching this. Particularly, this is something that has been discussed over and over and over, and coming now and showing this and mentioning that in the future we may reallocate work. Well, those actions should have been done way before, because we spent quite a bit of money on this particular vendor. And there are other vendors that are doing very well. Again, you didn't show their performance on the actual testing, how quickly they are responding and providing the results back and all the other metrics. I think I would like to look at that, because this vendor should be excelling beyond anybody's imagination in the other metrics for us to continue doing business with them at the rate that they're doing with MWB.
I can say briefly on that note, they are among, if not the strongest performer on the school testing work they are doing. Not that excuses any of the rest. I absolutely hear your point, but they are among the strongest performers for what that's worth.
Okay,
this is Danielle. If I could interrupt quickly, Finney, you have our word that our team will be working very closely with Chris and Ted and team to relook at these contracts again. Just in the defense of the operation, we're still in the middle of that pandemic. As I've said, we always trail a little bit behind. So now we're taking a look back at these contracts and focusing on the MWB, as you've seen us perform a little bit over the last couple of weeks and maybe month and a half. We will be doing the same to partner with you here. So we do anticipate those numbers to increase. We will be holding our suppliers accountable, and we'll be partnering with you to do that.
And Danielle, I agree with Benny. I just, if there is a rationale, and I'm struggling a little bit because the other vendors have been able to meet the requirements with the one exception. Are they so uniquely qualified? Are they so, are the other vendors incapable of picking up the work they're doing? I mean, I haven't heard, I heard they're a strong vendor. I haven't heard that they're an indispensable vendor. And I'd like to better understand, as you go back and look at the vendors you had to drop some vendors, take a look at them. And I'd like to hear back, whether you would make a statement that they're like indispensable.
And this is Danielle. I would leave that up, of course, to the operational leader here. But, it's a difficult dance when we look at MWBE and increasing our percentages toward that. Our mission, vision, and value is to try to right now get to a 30% marker, if not above and beyond. And these conversations are happening openly and honestly. And we have a diverse group of vendors that are supporting us in this manner. And we're trying to bring them each up through that MWBE goal. But there are sometimes, as we know in general business, stronger operational performers. So you don't want to cut your nose to spite your face. So you tend to hold their feet to the fire over time while partnering with them to get to a certain place. We're actively doing that now. Like I said, that we're still in the middle of that pandemic, but now that we're not essentially in a worry and a tizzy over everything operationally, at least on my side of the fence, we're able to provide some support to help you get where you need as an operational leader to have the highest operational performance as well as meet or exceed that MWBE goal. But again, part of this falls on me as well, because the support structure wasn't 100% there during the midst and the height of the pandemic. And you'll see us now starting to flip back into normal operations to support Ted and Chris and team. So I want to say that we do commit to doing this, and we will be able to help you continuing to go forward.
Ted, talk about the
Danielle.
contract. You have to have the contract?
Yeah, so just to level set, I think about the context for this versus where we're going in the future. What you're seeing here was work that was done at the height of the pandemic, where we wanted to keep our schools open, and we needed to do everything we could to do testing, which is the key way that we kept our schools open, being the only big city in the country to open their schools, for in-person learning throughout this year. This, what we're talking about today, is a 1-month extension of the work that we've been doing, which is, its origins were again at the height of the pandemic. Moving forward, for the next bigger contract that we're going to have for all of this work, we're going to be able to address absolutely everything that we're talking about here comprehensively. And that's what the next phase, to use Danielle's words, that's where we're taking what we've learned about the pandemic so far. This enables us to have the time to do it right, to your point, Fenny. And we will do it right. And that's why we want to have the extension now to give us that time to bring back to the board what the future state should look like, especially with respect to the role of MWBE in the much, much larger contract to come that will define how we're able to keep our schools safe moving forward.
So let me suggest a process here, because this is a complicated issue. You can vote no. It will have an implication in our ability to deliver testing in the next month. But we very much respect the board. The board is not a rubber stamp. And if the feeling is that we all recognize that this contractor has not done what we've asked them to do, right? That's how it works, right? The contracts were created in an emergency to open up the largest school district in the country. We needed a lot of testing at a lot of different places. We succeeded in that. We're doing more testing than anybody else is doing. Our recommendation is, given weighing it is, were we able to persuade them? No, we were not able to persuade them. That's what Fenny has noted. So the day is very clear. Were we able to persuade them? No. At this point, we really only have 2 options. The option we're recommending is let us do it for a month more so that there's no interruption and we will get it right in the new RFP, which we have time for, or vote no, that even if there's going to be a hole in the testing, we feel that we cannot let a contractor that hasn't been willing to work with us in good faith to do it. I think those are the only 2 options at the end of the day.
Mitch, is there another option where, Chris had mentioned we can sort of direct work?
But we will do that. I consider that as part of
but beyond that, do we have to approve an increase that goes to all of the 6 vendors? Or can we say, that we're only approving for the other 5 or something like that? Is there an option like that?
Is it a
for
time
this
or
month?
I thought it was a time as well as a money.
Just money.
It's just money. Well, but
It's just money.
If the contractors that we're talking about have fully spent, then it has the same effect, right? If they fully have spent already, then it's not a question of redirect, it would have to end, right? We can't spend money that you haven't approved.
Right.
But I think just
What I'm
following up.
saying is, go ahead, Sunny.
No, following on Frida's thought, do we have to approve an extension to all this, or can we approve the extension to MedRide, Rapid Reliable Testing, SOMOS, and BRL? Ted and Chris, will that allow you?
We're saying, yes, you can, but no, we won't be able to do the same volume of school testing.
So that would impact the quality of operation.
We would have to, for the next month, do less school testing. The other groups do not themselves have the capability of filling the hole.
In that case, sorry, Sally, I just want to understand this. So, Dr. Katz, I think what I'm hearing is that they are so necessary that if we don't approve them, we will not be able to do the testing. So we will not be able to shift work, even if we approve it. So
We can move to try to direct as much to the other contractors, and we would do that, but we would not, without these two, be able to achieve the number of tests. Are there other people out there who could do it? Yes, but we can't get them in the next month, right? That's what the new RFP is. The new RFP assumes a different set of providers.
Yes, I would like to propose a third option, or maybe a fourth.
Good, I love options.
Why don't we, I mean, I think we could move forward because we don't want to impact the work being done at DOE, but letting them know that they're not going to be allowed to apply for the next group unless they come in with a plan that shows that they're going to be upping the game on the MWBE.
I would say a friendly amendment. I don't think we can say you can't apply, but I think we can write the RFP so that in order to be a successful bidder, you have to have an appropriate MWBE.
Yeah,
Okay.
I think I would like to add to what Sally said is that because the meeting is public, in a way the meeting is will have that effect in a way. So the information is out there. This conversation is out there as to how these contracts are supposed to operate. I think we should vote on it and then we'll have another conversation on this in the full board meeting.
Right. So I agree. I think that the vote then that I'm hearing is that we vote on the resolution as it is, with an understanding that the T2 team is going to try to manage the contract flow for the remainder, the next month or two, to try to move it away as much as possible from Fulton at this point. And then, in terms of how the next process goes, we'll take that up at that point. So there's no amendment to the resolution at this point, correct?
Correct.
Yes.
Okay. So are we ready to take a vote then on this?
Yes.
Okay.
Yes.
So Jose,
Yes.
Dr. Katz,
Yes.
Sally,
Yes.
Benny?
abstain.
Okay, and I'll vote yes. Thank you. The motion carries with the discussion that we had, hopefully is on the record here.
Thank you.
Thank you. So our last action item, Dr. Long, is also a T2 core resolution.
Yes.
You're going to bring us through that one? Thank you.
Yes, I would love to. So I'll start with reading the resolution. Authorizing New York City Health and Hospitals Corporation, the system, to sign contract renewals through December 31, 2021, with 36 not-for-profit community-based organizations listed on Attachment 1 to this resolution, the CBOs, to continue their community outreach work promoting COVID-19 prevention, testing, and vaccination messaging with an option exercisable solely by the system for an additional 6 months for a total amount not to exceed $27.5 million for the entire group, and with sublimits by tier of CBOs indicated in Attachment 1. So, thank you for your time today. As I'll go into the presentation here, I just want to draw out two strands from the last presentation we had. First is that from a testing standpoint, our ability, as Chris Keeley said, to get the word out into the community about why this is important and how we're all working together to keep our city safe has resulted in New York City doing more per capita testing than almost any other country in the world, with the exception of some of the smaller, very small European countries. What I'm going to walk you through here is the critical role that our community-based organizations have played in that effort. So by way of background, community-based organizations are trusted messengers. So far, they focused on the 33 Task Force for Racial Inclusion and Equity neighborhoods, and they're the voices out there in our communities that are explaining why it's important to get tested and how getting tested contributes to each individual's ability to keep their family, their community, their city safe. We are specifically seeking approval for $27.5 million, which would be funded through the existing T2 MOU with OMB, which is effective for expenses through June 30, 2022. Next slide, please. Okay. So by way of background for the overview of the procurement, in July of 2020, Test and Trace issued an RFP seeking not-for-profit CBOs to do community outreach and issued such contracts under the President's Emergency Declaration. That was for July through November, and 41 CBOs were awarded contracts for that term. That was for $8.1 million of funding, and total amounts were distinguished in terms of 3 different tiers based on the level of activity that the CBOs were doing. Based on satisfactory performance and the persistence of the epidemic, renewals were issued from November through June of 2021 as the CBOs met and exceeded milestones set out for them, which I'll go into more detail in a moment. That specifically was for 39 CBOs for an amount of $15.8 million of additional funding. That again is broken down into 3 different tiers. As of April 3rd, 2021, New York City Health and Hospitals will have paid $13.9 million, or had paid $13.9 million to the contracted CBOs. Next slide, please. So in terms of the CBO's milestones and completion and what they've completed so far, on the left-hand side here, you can see what we set out for the expectations. We said for the CBOs, expectations were 1,100 leafletting shifts, 444 virtual town halls and meetings, 95,000 contacts from phone, text banks, and call lines, email, social media posts. I'll draw your attention all the way to the right-hand side of this, where we show the percentage completion compared to what we expected. And the clear message here is the CBOs far and away exceeded the expectations that we'd set out for them. For example, if you look at the contacts from phone and text bank or call line, we exceeded expectations by over 1,400%. And we exceeded expectations across the board for each of the metrics that was set out. In a moment, I'm going to explain to you in a little more detail how we've used the fact that our CBOs have done such an amazing job exceeding expectations to set a higher bar for the expectations I'm laying out here. Next slide, please. So here, in terms of the 39 CBOs that were part of the initial renewal of funding, there were tier 1, tier 2, and tier 3 here, and 36 of the CBOs consistently met all milestones and requirements. Next slide, please. So we're seeking here to renew contracts with these 36 CBOs. They're a key to the vaccination effort. They're essential for our hyperlocal work, where we look across New York City for communities that are having lower testing, higher percent positivity, and now lower vaccination rates contributing. And we really focus our efforts on from the grassroots to, again, use our CBOs as the trusted messengers that our communities really listen to get tested and to also get vaccinated. Our timeline here is this would be from July 1 to December 30, with an optional extension period through June 30 of 2022. Next slide, please. Here I've listed the 36 CBOs that we're seeking in our proposal to extend. Next slide, please. In terms of the diversity of our CBOs, all are not-for-profit, and that was actually a requirement of the initial RFP for all of the CBOs. Of note, not-for-profit entities cannot be MWBE. An important note is that our CBOs have hired very diverse staff. So in particular, 87% of our CBOs have hired staff from Latino communities, 72% of our CBOs have hired staff from Black communities, 55% who are immigrants, 58% have hired staff who identify as part of the LGBTQI community. Our CBOs have hired staff speaking over 15 languages, 87% have hired staff that speak Spanish, and some languages that I'll highlight for you are French, Haitian, Creole, Punjabi, Urdu, and Yiddish. Next slide, please. So our CBOs have long roots in all of our communities, and that's what makes them the trusted messengers that our communities really listen to, and that has really been the cornerstone to our success in getting our communities to come out and get tested now with our vaccine effort. Now, our CBOs have hired 393 staff. 71% of these staff are W-2 FTEs. 29% are 1099 FTEs, which I call out to make the point that different people have different non-traditional work histories. Some have justice involvement. So for these variety of reasons, we didn't want to inhibit our CBOs in terms of hiring the right people to get through to our communities. the right people from our communities to help our communities. That's why 29% have been 1099 of the 393. In terms of our CBOs using subcontractors, 6 of our 39 CBOs to date, or 15%, have used at least one subcontractor. The CBOs that have used subcontractors are listed on the bottom right-hand side here, those 6 CBOs. Next slide, please. So in terms of the proposed deliverables for this current proposed contract extension, what I want to do here is walk you through what we're proposing the deliverables are for this next phase of CBO work, and I'm going to highlight for you and some numbers that I'm going to add on to the slide here for an additional layer, what the former requirements were, or for the former milestones were, to show how we're really ratcheting up the new requirements based on the exemplary performance overall of our CBOs in terms of exceeding expectations. So tier 1, which is the highest tier, meaning the most intensive effort, the most FTEs, we're asking for 24 leafleting shifts a month. That's up from a previous metric that we set out of 12, so double. We're asking for 6 virtual town halls and meetings a month. That's up from 4, so that's a 50% increase. Contacts from phone, text bank, or text line, we're going up to 3,000 here. It was 1,000 initially, and you could see in the former slide that this is one of the metrics that was far exceeded. So we're tripling it in terms of the new requirements we're putting out here. Regular email updates, 4 per month, and social media posts, 30 per month. That's up from 12 actually. It's consistent across that in terms of our ratcheting up across all the categories. I just wanted to give you a comparison for the first tier here, just to show that we're basically doubling or tripling almost every category based on the exceptional performance so far and exceeding expectations. Final slide, please. So in sum, we're seeking approval to extend the 36 CBO agreements through FY 22. The contract term would be from July 2021 through December 2021, with an optional extension through June of 2022. The implementation rollout date would start on July 1, 2021. The not to exceed would be $27.5 million. And funding would again come from New York City under the existing T2 MOU with OMB, which is effective for expenses through June 30, 2022. The funding is for FY 22, but as I mentioned above, we will reevaluate continued need in 6 months for the following 6. With that, I would love to answer any questions.
Thank you, Ted. So I'll go to questions. Jose?
I have no questions. Thank you, Ted.
Thanks, Jose.
Mitch?
No, thank you.
Sally? Sally, I think, are you on mute?
Yes, I was on mute, sorry. Just I was curious about the contacts from phone and text bank support line, the $1.3 million from the 95,000 expected. What caused that? I mean, where was it unique and not really replicated because of the situation we were in at the time? It's kind of staggering.
Yeah. I appreciate that, your comment, Sally. Actually, this was an interesting one. We looked into it. So it turns out that community-based organizations, particularly the ones that we have contracts with, had more robust and more comprehensive lists of people and how to reach out to them in their communities than we even anticipated. So that's why there was such a substantial percent completion above the expectation here, and that's why in the new proposal here for the contract renewals, we're proposing to triple the initial expectation that we put out for them based on how well they did here with their progressive phone banks.
Okay, thank you.
Thank you.
Thank you. Seniowski?
Thank you, Frida. Ted, again, as always, very impressive, the work that all the groups are doing. And I also appreciated the metrics that you show that Sally alluded to, very, very impressive. I also I really like the information that you share in terms of the staff of this CBO, very diverse and really representing some of the hardest hit communities that we wanted to really target. I just have a question, and I don't know if you are aware, but maybe a couple of years ago, there was an initiative out of City Hall and the Department of Culture Affairs looking at the diversity of the boards in the different non-for-profit that operated in the culture and art world. And I don't know if you have any information about these CBO's leadership diversity as well as their board diversity. I think that may be something interesting to understand. Again, very impressive, the staff, but looking at the leadership and their board may be also an interesting information. I think there is a lot more discussion about looking at leaderships in all different organizations, and I think that may be something of interest.
Yeah, Fenny, that's a great question. I don't know the information off the top of my head, but I will look into it and get back to you directly on that. And actually, if you want to share with me the report you're referring to as well, I'm not familiar with that, but I'd love to be.
Yeah, it was for the cultural affairs, and it was an interesting movement that the commissioner Finkerball at that time made. And again, you have some of the biggest names in culture here in New York. So I think this is again very impressive, really great work. The metrics really show the impact that they're having, and looking at the numbers that we have seen on the lower hospitalization and all that, I think we should be very proud and thankful for the work that all these organizations are doing. So thank you, Ted.
Thanks, Penny.
Okay, great. Thank you. And I agree, both Chris and Ted, on both of these resolutions. The work that you guys have been doing is just incredible, and I think the results have spoken for themselves, and this entire city is grateful for it. So thank you. The one question I did have for you, Ted, is I don't know if you've built in a contingency. I just did some quick math on the amounts for the renewal and the numbers of organizations, and I think it totals a little bit less than the $27.5 million. It's $26.5 million, so it's about $1 million less. So are you building in a contingency for the request here?
I'm actually joined by Krista Olson.
Okay.
No, we don't have a contingency. I can get back to you on what that additional amount would be, unless I have the T2 finance.
Maybe I did my math wrong, but which is
Yeah,
possible, definitely.
Yeah, there shouldn't be additional money, but I can also look into it. Yeah, we'll double check the math for sure.
Okay, so, but just to be clear that what we would be, if there is a discrepancy, what we would be approving would be the total from what the math
That's
here
right.
would total to.
Yes.
Okay.
Thank you.
Okay,
Just
great.
want to
Thank you.
say, Frida, that nonprofits often get a bad rap for their ability to do really
Meaningful.
very challenging tasks. And I think this is like really pays homage to the work that can be done in the middle of a pandemic by really, and really reaching down and getting grassroots organizations involved.
Agreed. Thank you, Sally. Okay, great. So why don't we take a vote on the resolution? I will go through the members. Jose?
Yes.
Dr. Katz?
Yes.
Sally?
Yes.
Penny?
Yes.
And I vote yes as well. So the resolution passes, just with the caveat that we will clarify the not to exceed number if necessary. Great, thank you. So is there any old business or new business to come before the committee? No. With that, then meeting adjourned. Penny, I definitely did not live up to your example earlier today.
Don't worry, very important meeting. Thank you for the discussion. Again, thank you,
Yes.
Chris. Thank you, Ted, for all your hard work.
Thanks,
Thank
Benny.
you so much. Thank you.
Yeah, thank you.
Bye-bye,
all.
everybody.